Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, May 15th, and this is my daily briefing. We're still holding steady at 41 cases to date in Missoula County. 39 were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have no active cases in isolation, and we're no longer monitoring any close contacts. The state of Montana has had a total of 466 cases, with 4 new cases added since yesterday, and there have been 16 deaths statewide. So I have a few different things that I'm going to talk about today. I'm going to talk about what is reopening today under the governor's reopening plan. I want to talk a little bit about rate of positivity. And lastly, I'm going to cover a new complication from COVID-19 that's popping up in children. So under the governor's reopening plan, gyms, fitness studios, gym pools, movie theaters, and non-tactile museums can open today as long as they can meet certain requirements. These requirements include operating at half their normal capacity, supporting social distancing, screening employees for symptoms, and enhanced cleaning and sanitizing measures, and holding off on indoor group classes. Our health department looked over these requirements and agreed that with the current situation in our community, these facilities should reopen if they can reopen responsibly under these requirements. If you're concerned about a particular facility not meeting these requirements, you can call the Environmental Health Division at 406-258-4755, or you can email envhealth@missoulacounty.us. So next I want to talk about rate of positivity and where we're currently at with that in our county and in our state. The rate of positivity in a community is really an important indicator because it can provide insights into whether a community is conducting enough testing to find cases. If a community's positivity is high, it suggests that they may largely be testing only the sickest patients and possibly missing more mild asymptomatic cases. The lower positivity rate may indicate that a community includes patients with milder or no symptoms in its testing. According to the World Health Organization, countries that have conducted extensive testing for COVID-19 had positivity ranges between 3 and 12%. According to Johns Hopkins University data, Montana's current positivity rate of 0.18% is the second lowest in the country, behind only Alaska. That rate is based on a 3-day average. In comparison, this is what they're seeing in our neighboring states. In Wyoming, the positivity rate is at 3.72%, North Dakota is at 4.44%, Idaho is at 6.03%, and South Dakota is at 9.37%. This was a different story for Montana in March, when testing criteria and testing supplies were much more limited. Then the 7-day positivity average for the state hovered between 15 and 30%, indicating that we were really only testing those with more severe symptoms in higher risk groups and likely missing cases with milder symptoms that were more likely to spread in the community. In Missoula County, as of yesterday, we've performed 2,320 tests since testing began in March. This number includes testing at the Fairgrounds Clinic and reports that we've received from other healthcare providers. 39 of those tests have come back positive, so that puts us at an overall rate of 1.7%. We do have 2 epi-linked cases, meaning that they were never tested, but they had symptoms consistent with COVID and were close contacts of a confirmed case. Even with a total of 41, the overall rate still sits at only 1.8%. Does this mean that we don't have to worry about COVID in our community anymore? Absolutely not. It means that in order to keep a resurgence of cases at bay, we need to continue testing anyone showing symptoms so that if they do test positive, we can get to work contacting and isolating their close contacts. The state has a goal to work up to testing 60,000 people a month, which would mean around 6,000 to 8,000 people per month in Missoula County. Adequate testing, which leads to more adequate isolation and contact tracing, is what will help us keep COVID from spreading in the community again. As a reminder, the testing center at the fairgrounds is open to any Missoula County resident, healthcare worker, or first responder with symptoms. You can just call 258-INFO, select option number 2 to make an appointment. And you can also find a list of other providers who are performing tests at missoula.co/cvirus. So one last thing I want to talk about is something that you may have heard or read about in the news called multi-system inflammatory syndrome in children. Also sometimes called pediatric inflammatory syndrome. It's a post-viral complication that's been associated with COVID-19 in children. Doctors are investigating around 150 suspected cases across the United States. Most of them are in New York, but reports have popped up in at least 18 states. We're still learning a lot about this syndrome, and it does appear to be rare, and so far they think that it's very rarely fatal, but it's still really important for parents to be aware of the symptoms, which can include a persistent fever, a rash or changes in skin color, red eyes or conjunctivitis, bright red tongue, cracked lips, abdominal pain, and swollen lymph nodes. Because the typical COVID symptoms, including the respiratory symptoms, can still be very mild in children, it's important to be on the lookout for any of these other symptoms and to call your child's healthcare provider for advice on the next steps. So that's all I have for my daily briefing for today. So as always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CINDYFARR. You can follow us on Facebook at the Missoula City County Health Department Facebook page. You can call 258-INFO if you have questions about COVID-19 or want to know where you might be able to find resources, or if you'd like to make an appointment to get a test done if you're having any symptoms, you can call that number. And you can also check out our webpage at missoula.co/cvirus. So that's it, and everybody stay healthy, and I'll talk to you again on Monday.